This is what it looked like before.
Yeah.
Not a bad nose. And this is what it looks like after.
I love it so much. You can really tell the difference.
You can tell.
We interrupt this program to bring you a special report.
Hi guys, my name is Dr. Haroon. I am a cosmetic doctor who specialises in non-surgical aesthetic treatments. Today, we are carrying out a non-surgical rhinoplasty. A rhinoplasty is any procedure that aims to change the appearance of the nose. Today, we'll be doing this non-surgically with the use of dermal filler and a few injections. Unfortunately, for this particular procedure, not everyone is suitable, and it all comes down to the original shape of your nose and what your ideal outcome is. If you have a small bump at the bridge of your nose, known as a dorsal hump, this can be camouflaged by placing small amounts of filler above and below the bump, which minimizes the appearance of the hump. If the angle of your nose is pointing straight or downwards, placing dermal filler at the base of the nose can anchor the nose and raise the angle. Or if you have a droopy tip, carefully placing dermal filler here can raise the tip of the nose, commonly known as a tip lift. These are all good reasons to have a non-surgical rhinoplasty. However, if you're someone who has a large dorsal hump or a deviated septum, surgical options may yield better results. A common question I receive is, will my nose look bigger after the procedure? And this is a sensible question. After all, we are adding dermal filler to the nose to change its appearance. The simple answer is no, as long as it is done well. In fact, after the procedure, the nose should look shorter, sharper, and straighter. And the reason behind this is because straight lines will look shorter to the human eye than a line which is bumpy or curved. We also use tiny amounts of dermal filler for this procedure to achieve the desired result. And for most treatments, we end up using less than ½ ml of dermal filler. Let's get into the procedure and meet our lovely client. How's it going, Kirsty? Cool, nice to see you again. So today we'll be carrying out a non-surgical rhinoplasty. You haven't had this procedure done before, and I know we've talked about it in quite a bit of depth before we came here today, but I just want everyone to know what the desired outcomes and goals are.
Yeah, so just a little bit of a straighter nose here, and then just a little bit in the tip, I think, just to point it up a little.
Fantastic. So these are really good expectations that you have for this particular procedure. So with the tiny little bump here, we can put a bit of filler before it and maybe a little bit of filler after it, and it should completely straighten out the bump. With the tip of the nose, you mentioned that you want that cute ski slope right at the end, and placing a little bit of filler in the tip of the nose should be able to achieve that result. Is there any particular questions or concerns that you have with this procedure?
No, I'm a little bit nervous.
Cool. So just to make you a little bit less nervous, it's a very safe procedure. We'll clean the area. We'll put a bit of numbing cream on, which takes the edge off. It doesn't completely get rid of the pain, but it's quite a quick procedure. It usually takes around 5 minutes. And there might be a little bit of swelling on the day, maybe a little bit of bruising. I always say just give it a full 2 weeks for all the swelling to come down and for the filler to integrate. And that will be the final result at the end of the 2 weeks. Roughly, the results should last anywhere between 9 to 12 months. So just to recap some of the risks that might be involved with this procedure. So swelling is fairly common with any injectable procedure. Usually swelling tends to peak the next day and then it will start to settle after that. Bruising, we're pretty good at avoiding any big cracking bruises, but pinprick bruises are fairly common with any injectable procedure. There's always a risk of infection, but it's very low. We use clean gloves, we clean the area before and afterwards, and of course we use sterile needles as well. The only other thing that I talk about with any dermal filler treatment is vascular occlusion, or a blocked blood vessel. So filler, in theory, can block blood vessels. If this is a blood vessel, filler can block it directly or indirectly, leads to lack of blood flow to an area of the tissue. The most important thing that I want you to be aware of is the signs of a vascular occlusion, which is pain that gets worse as the day goes on. If you are experiencing pain that is getting worse as the day goes on, just give me a call, I'll come and see you. If I think there's a blocked blood vessel, I'll put some dissolving agent in there and it completely resolves the blockage, no long-term consequences. So in regards to the steps of the procedure, the first step, we'll take some photos just so we have a record of the before and after photos. We'll clean the area. We'll put some numbing cream on. That usually takes around 5 to 10 minutes to reach maximal effect. And then after that, we can carry out the procedure. It's only a few injections. Some of them do sting a little bit, but it's not going to be the worst pain in the world. On the day, you'll get a good result, but remember the final result is always at 2 weeks. All right, Kirsty, so if you've got no further questions, what we'll do is we'll clean the area, we'll put some numbing cream on, and then we can get started. So that was it, guys. That was a whistle-stop tour of a non-surgical rhinoplasty. As you can see, the nose looks straighter and the tip has been lifted. Typically, these results will last anywhere between 9 to 12 months. There might be a bit of swelling on the day and maybe a little bit of bruising, but the client should give it a full 2 weeks for everything to settle, and the final result will be visible at 2 weeks. I hope you've enjoyed the video, guys. If you'd like to find out more about this procedure or any other procedure that we do, then please get into contact. Thanks a lot. Bye now.